It's revolutionary. It's a whole nother paradigm.
There's a perfect balance, a way we can approach the body.
It changed my life and it changed my career, and I'm never going back.
Matrix repatterning works. Things shift and things go back into place.
Matrix repatterning brought me to that next level.
It's just mind-blowing that my back is normal again.
The value is the joy in changing people's lives.
They were normal, the pain was gone, they carried on. That was it.
Way more energy and just zero pain, which I've never had before.
I'm back to normal. I got my life back.
Release of injuries that have accumulated over a lifetime.
About the beauty of what this work is. All of us can do this.
I'm just so thankful that Matrix came into my life.
I'm back! Yeah.
When I started looking at head injuries and people with headaches or who've had suffered a concussion, I noticed that there were often changes in the shape of the skull. For example, if you fell on your head, you'd actually see a flattened area that would show up, or areas around it that bulged. And that's because the bone absorbs that energy more than many other tissues because it's very dense. However, something that we have inside our head and inside other parts of our body are fluid-filled structures. So we have inside our head, we have a fluid chamber which contains the brain. There's fluid surrounding the brain as well. And so when we have a head injury, that fluid absorbs that, and that fluid actually expands. So think of a water balloon. The fluid inside is so dense that it can only do one thing with that. It actually expands. But even just a fall, that force coming in through the trunk is transferred up through the spine, up through the neck, into the head as well, and we call that an indirect concussion. One of the things we can see in matrix repatterning, our assessment shows us where that injury is actually drawn into, and that is a measurable change. We can see the change in shape. We can also detect the electrical changes. And then once we determine the source, or where it actually has caused the cellular damage, that can easily be restored. That can be brought back into alignment through very, very gentle pressure, and along with the application of a very gentle electrical field, which realigns the electrical properties of the cell. So as a result, we've seen rapid changes in measurable function, things like improved reduction in headaches, improved vision, improved hearing, reduction in symptoms like dizziness or vertigo, and also measurable changes based on other tests, which include a test we use called the brain gauge. Those are changes that Dr. Norman Doidge was able to verify in his evaluation of patients as well.
Most of my days incorporated a headache in some way, shape, or form, and often weekly was a migraine, to the point where it was it felt really debilitating, to the point where I would be in bed, lights off. I couldn't look at bright lights. I couldn't hear strong sounds. I couldn't do strong smells, and it just was to the point where that was occurring almost weekly. Before matrix repatterning, a lot of my everyday was intense pressure behind my left eye, to the point where I really couldn't look towards like my left peripheral vision at all without getting some sort of sharp pain right behind what felt like my left eye socket, or getting that intense pain, pressure, shooting pain. And so that was really every day. I, from the time I was little, would seek out massage therapists, chiropractors, anything and everything under the sun to try and get some sort of relief, whatever relief I could. And it really wasn't until I found matrix repatterning that I got not just temporary relief, but long-term relief. I think I'm in more optimal health than I've ever been before.
The results we get with concussion therapy at this point in time are not possible with anything else. And at some point, it just has to take off and explode and be, like Dr. Doidge said in his book, The Brain's Way of Healing. Most people with concussion should get matrix repatterning therapy as a first line of treatment. When enough practitioners realize that to be true, this work will take off.
When you start to see these changes, see the changes in the shape of the skull following an injury, and how that then changes the symptom picture is significant, because mechanical stress due to these deformities from injury puts stress, we think, on tissues like the dura, the axons, the glia, and even the blood vessels in case of migraine. We've had many great successes with migraine sufferers, and I think part of it is because of the deformities, there's actually alteration in the background dilated state of certain blood vessels, or triggering even sort of neurological cascades because of increased action potentials, or let's say permeability of the axon membrane. So lots of good results with cases like that.
As a physiotherapist, it's so much fun because I would never be able to treat, I would never see these people. And for them to have hope and realize that there's something out there and they don't have to be, and it is a little more complex than the medical world maybe realizes. There are answers. There is treatment. You don't have to be in pain, and it's something you have to experience, and it works.
I had another young man who somehow got into a fracas and was hit over the top of the head with a vodka bottle. And he had a variety of things going on. Most significantly, he was diagnosed with anorexia. It's not that common for males to be diagnosed with anorexia, but he had no appetite, and he had suicidal ideation. After his first treatment, he said, "I'm kind of hungry." And I said, "Why don't you go get a steak?" And he said, "That sounds so good." And he went off and did that. This is a guy who had been unable to eat for quite a long period of time. Then he went back to college, no longer depressed, no longer suicidal, after, I think, 4 treatments. I had a patient who'd had a migraine for over a year, who had been hospitalized, who had been treated by a variety of practitioners in a variety of ways, taking a cocktail of polypharmacy, who is now leading a normal life thanks to matrix repatterning. The list goes on and on. Those are just the head injury cases. I mentioned before that the NFL linebacker, ex-NFL linebacker, who had to be treated weekly or he could not function, is now not in need of treatment anymore thanks to matrix repatterning. As I looked into this area, I found out that in the medical world there is no treatment for head injuries other than what they call watchful waiting, treating the inflammation and other symptoms and hoping brains heal. And I've been able to offer results to head injury patients that they can't receive anywhere else. And head injuries really screw up people's lives. And so it's really nice to be able to contribute to serve the planet on this level using this work.
I felt terrible. I felt every day I woke up heavy-head, groggy, vertigo. Simple conversations would overwhelm me. I couldn't concentrate. I just couldn't even be in a social situation. I experienced anxiety, this feeling of I'm never going to get better, and I actually felt depressed too. And then I was diagnosed with post-concussion syndrome by the neurologist. I went to different practitioners. I tried massage therapy. I did chiropractor. I also did osteopathy. And it seemed they gave me relief, but I wasn't really getting better. I almost seemed to plateau and not move forward. I thought, before I discovered matrix repatterning, that this was going to be my new reality. I thought, I am never going to be able to go back to work again. And it was really a difficult time in my life. And so matrix repatterning brought me to that next level where I'm back to normal. I got my life back. I can work. I can do all the activities that I so love doing. And it was unbelievable. I went to one session and as I said, every day I felt like I was on this ship. I had such a sense of vertigo. After one session, and I went, oh my gosh, the room's not spinning. My vertigo's disappeared, and continued on with the sessions, and I started to feel more clarity. I used to have to walk with walking poles in order to just walk straight, and I could walk better. My thinking ability became easier, and I started to improve. It does work, because, even some days I'll go, oh my gosh, my neck is still good. My back pain has not come back. It's fantastic. I'm back! Yeah.
The stuff I see on a regular basis for anybody else would be amazing stories. So to me, they don't seem amazing because it's what I expect. I would like to tell you a story, though. I had a concussion client come in, a 17-year-old concussion client come in to see me 2 years ago. He didn't want to be there. Why didn't he want to be there? He was suffering for 2.5 months. His mom was taking him everywhere. Medical treatment, alternative treatments, hands-on treatments, and nothing was helping him. And they came in, and he came in reluctantly. He did not want to be there because he knew this was one more thing that wasn't going to help. He's not, 5 treatments later, he's now a testimonial on my website. He's at the university. He's going to school. About a month ago, I was taking a walk in my neighborhood, and I saw his mom walking with a young man. And I called out to them, and I turned out, and he turned around, and it was the young man that I had treated. He told me, I tell people, if the world was fair, that guy should be a billionaire. Why? He got his brain back, doing a technique that just makes sense. And at that moment, I was so thankful that I listened to a teacher in Chicago who didn't even understand matrix repatterning therapy 13 years before say, Andy, I think this should be up your alley. And instead of waffling and looking at the money, I just said, okay, I'm going then. And I did. And it didn't just change my life, did it? Change his life, change his mom's life, change his dad's life. It changed his little brother's life, who 6 months later fell off a skateboard and was the only teenage concussion case that ever came to see me happily. Through a concussion with a smile, I saw what you did for my brother, and I know you can do it for me.
The best way I can probably describe it is that it's really been revolutionary and given me back that great feeling, way less tired, way more energy, and just zero pain, which I've never had before.